Hi, this is Jill from the Interstitial Cystitis Network, and I'm here today to talk to you about managing IC flares. Now, if you're a newly diagnosed patient, you may not understand what a flare is. It is just a sudden increase in your symptoms. You might have more frequency, more urgency, more pressure, or more pain. Now, the good news is that flares tend to be short term. They can either last a couple of hours, maybe a couple of days, but it's pretty rare that they last longer than that. Now, the secret to managing an IC flare is to understand the different types of flares you can have. The two most common are a bladder wall flare or a pelvic floor muscle spasm/flare. So let's talk about those for a moment. A bladder wall flare occurs when your bladder wall has been irritated, usually by something that you've eaten or drunk. Typically a soda or coffee, and that's because urine is scouring the wounds in your bladder and creating a lot of pain and discomfort. When patients describe these flares, this is when they use they'll describe it as razor blades in their bladder or ground glass in their bladder. It tends to be very sharp and uncomfortable. A pelvic floor flare is different. It's lower in the belly, it's steadier, it's more consistent, and it often has a vaginal burning quality to it, or you may feel like something is falling out of your vagina or your urethra, or something is being pushed into those. And in general, those occur when you've been sitting in a car for a long period of time, when you've had sexual relations, or any time that your muscles down there get traumatized. When you're sitting on a bike, for example, that's a well-known trigger for a pelvic floor flare. So the question now is, how do we treat them? Well, we're going to treat them very differently. If you're having a bladder wall flare, your goal is going to be to soothe and calm and comfort your bladder. And the first way that we're going to do that is by diluting your urine. You want to make sure that you drink a glass or two of water so that your urine is nice and clear. Normally your urine should be a very pale yellow, clear color. If it's dark yellow or cloudy, you're probably not drinking enough water. The second thing that you might consider doing is using a product that can alkalinize your urine. What that means is it takes some of the acid out of your urine. Pre-leaf, for example, is a very popular supplement often used by IC patients. You could try taking some Tums pills, or one of the old therapies was actually putting a 1/4 teaspoon of baking soda in a glass of water. Now, we don't do that very often now because we know that baking soda is sodium, and for anybody who has high blood pressure, that can create a problem. So in general, patients now prefer to use pre-leaf or Tums. Now, if that's not helping, the next thing that you might consider trying is something called a urinary anesthetic. What that does is it numbs your bladder wall, and you may have already tried it because that's the product that turns your urine orange. It's called Pyridium, or the over-the-counter version is called Azo Bladder Pain Relief Tablets. Now, if that hasn't gotten you the relief that you're looking for, you may be having a pain medication moment. It's very important that you talk with your doctor about having some relief if your symptoms get severe. In general, IC patients use a short-term opiate like Tylenol with codeine. So if you feel that you're suffering, if you're up all night crying in pain, that certainly means you're suffering. You need to talk to your doctor about it and ask for some relief. Now, with a muscle flare, we're going to treat that differently. Our objective with a muscle flare is going to be to relax muscles. So what's the first way to do that? Well, by stopping and resting. Put your feet up. That's important. Rest for 30 minutes. See if that makes a difference. If that doesn't help, use some heat. You can take a hot shower, you can take a warm bath, or you can use some heating pads. We have body heat heating pads, which are great because you can attach them to your underwear or nightgown and wear them for hours. A lot of IC patients like to use microwavable heating pads. Electrical heating pads need to be used with caution. You should never go to bed with an electric heating pad because they can catch fire and burn. If you get an electrical heating pad, make sure you get one that has an automatic turn off after 20 minutes. Now, if heat isn't your thing and heat doesn't give you relief, the next thing that you can try is some cold. A lot of patients like to use a perineal cold pack, or maybe even a bag of frozen peas wrapped in a towel. Worth trying. If neither one of those get you where you need to go, the next thing that you consider is a muscle relaxant. We often use Flexeril or Valium. And actually the most popular muscle relaxant today used by IC patients is something called a vaginal Valium suppository, where you put Valium exactly where you need it the most, right next to your pelvic floor. And of course, if you're still not getting comfort, you need to have that discussion again with your doctor about pain meds. You may need to use them. Now, we have a couple of important rules with flares. Rule number 1 is if you have any visible blood in your urine, you always call your doctor. That is not normal to IC. If you have a fever or any sudden sharp pains that you've never had before, that's also worth calling your doctor. You need to keep them informed and let them know what's going on with you. If you need more information on managing IC flares, we have a couple of resources for you. Of course, you can come to our website, the IC Network, at www.ic-network.com and check out our flare management guide. Or you can go into our store and purchase our ICN special report on managing flares, which we can send to you. You can find that at www.icnsales.com. I hope that helped. Always keep the faith. Remember that you're not alone. We're here and we care.